How was it up?
No, it was about.
Somewhere in the world, but it's not there.
It is amazing how fast he's comparing what he does, like how far away you find. It's just
Wow. So, yeah, we're kind of over the hump at least. So that's one of the numbers. I think we'll take it actually. They don't need this quite well. People came out. I mean, I couldn't believe it by the time I got back from this last week. The track and stuff, this was garbage. And it was cleaned up. I thought it was quite easy. I almost feel like it gave people something to do that had an impact. So in some ways,
That's awesome.
you know, and there, one family that had that, was displaced, but overall, one was hurt, and those things. So I think not that it was a good thing, but I think just being able to have an impact on people.
You're forgetting something.
Good morning. My name is Angie Weideman, and I'm the Chippewa County Public Health Director. Thank you for joining us today for an update for Chippewa County and COVID-19. I'd like to start today with an update about state and local data. As of yesterday, Wisconsin had 837,567 people that had negative test results for COVID-19. 50,179 people had positive test results in the state. 9,742 active cases and 33,513 people that were released from isolation in the state. In the state of Wisconsin, we've had 4,493 people that have ever been hospitalized for COVID-19 and 906 deaths in the state. Chippewa County, the local level, as of yesterday, we had 7,385 people with negative test results, 200 people that have had positive test results, which is an increase of 29 since our last press conference on last Wednesday. Of those 200 cases, 37 individuals are considered active and being monitored by the health department, and 163 people have been released from isolation. I just want to explain too, with the 37 people that we're currently monitoring, we also monitor all the close contacts, and on average we have about 7 close contacts for each positive case. So the health department is actively monitoring over 300 people when you put that into context of the positive cases and all of their close contacts. We currently have 0 people who are hospitalized, and we have 79 individuals who are over age 40 and 91 people that are under age 40. We also thankfully have 0 people that have died from COVID-19 in Chippewa County. 800 tests were completed last week from July 19th to July 25th. And that is a decrease of 1,013 tests from the previous week, where 1,813 tests were completed. That previous week, we did have some large testing locations throughout the community, and that is why the decrease in testing. I also want to provide an update on our local data. After reviewing our 11 indicators at the local level, our current risk level is still high. This means we're recommending gatherings of 15 or fewer in indoor spaces and 50 or fewer in outdoor spaces while maintaining physical distancing. The physical distancing, including staying at home when sick and wearing a cloth face covering, are keys to maintaining the spread of the virus. To view the current metrics and the metrics of our past week, please go to our website, co.chippewa.wi.us, and go to the coronavirus information page. On the left side, there is a tab labeled COVID-19 data, and that has different data, including different data pieces, including our dashboard, our metrics, and a state map of cases by census tract. In Chippewa County, it took us just over 3 months to reach 100 positive cases, and since reaching 100 cases, it took just over 3 weeks to add an additional 100 cases. Doubling from 100 to 200 in just 3 weeks is concerning, and that is not data that can be explained by the increase in testing. We are also seeing an increase in positive cases. Speaking of testing and cases, we are hoping to be able to release additional data related to the COVID-19 testing event that happened last Monday at the fairgrounds. Unfortunately, we are still waiting on the final report. I know many people in the community, and including myself, are extremely eager to see that data and be able to break it down further for everybody. We were told it should be coming very shortly, but we do not have that final report yet. Once we do receive that final report, we plan to release additional information. Individuals should have been tested about their individual test results. And if you did go to the test event and you have not received your results yet, please reach out to your local health department. And you would reach out to the county that you reside in for those test results. We also did testing early July at the Stanley Correctional Facility, and around 1,800 tests were given to residents and staff at the Stanley Correctional Facility, and happily there were no positive test results that came from that event, and the testing took place July 6th, 7th, and 8th with support from the National Guard to do the testing. I want to really commend the Stanley Correctional Facility for excellent work in keeping their staff and residents safe. Also, with an increase in cases, we are looking at getting back to school and work, and that is on the forefront of everybody's mind. I want to first reassure all parents that the Chippewa County Department of Public Health works very closely with schools in the county, including the private schools. So we meet weekly with public and private school representatives to help plan for the reopening of schools. We meet with school administrators to discuss questions, concerns, processes, and best practices. And apart from weekly meetings, we are also in regular communication. So we have lots of emails and phone calls with different school representatives to help prepare. For example, last week our liaison officer attended the New Auburn School Board meeting. This week, Public Health is meeting with the Chippewa Falls Area School District with their medical advisor, school nurse, superintendent, and administration team. We are helping every district with their guidance, and we are helping to make sure that students, staff, and teachers are in a safe environment this fall. We are in the process of scheduling times to train school staff on COVID-19 signs, symptoms, safety precautions, and what isolation and quarantine mean. We also know that businesses are still learning how to deal with COVID-19 as a new normal. And I want to remind all business owners that Chippewa County Coronavirus page has a business toolkit that is available. If you scroll down under business, you will find COVID-19 business toolkit on our website. The toolkit does contain information such as how to best screen employees and how to communicate with employees and the community if someone in your business would test positive for COVID-19. The health department is also here to assist you in keeping both your employees, patrons, and all community members safe. I would now like to welcome Jenny Stark from the Cadott School District to give an update on the Chippewa County schools, and then I will be back later for questions.
Thank you, Angie. I believe all districts in the county have shared their initial plans for reopening with all of their families, and so that people can start to try to plan. As school boards are meeting in August, they all meet on different dates in the month. There's probably adjustments that will be made to plans. I can tell you Stanley Boyd and the Cornell School District will begin classes with students the third week of August, so they have had a waiver to be able to start earlier. In Cadott, what we are doing is kind of troubleshooting our plans for traffic flow, serving food, transportation. Most districts have updated before and after school traffic flow, even for parent drop-off and pickup, to try to avoid the congregating outside of the building or right inside of the building. For us, the buses will kind of line up. Students will get off one bus at a time, then that bus will leave, and then the next bus. Those kids will go right to their classrooms, just to avoid all of those, any congregation areas that aren't necessary. The other piece is all districts, before school starts, have a lot of professional development that they work with teachers on, kind of getting ready for the year. For all of us, that looks very different this year. We have a focus on the use of online supports, learning platforms. There's different platforms that different districts have, and as we are able to get more technology, how to best and most efficiently use that and help students to utilize that should they not be in the classroom every day. We also are providing professional development. We do every year, even in prior years, on mental health supports for students social emotional learning. There's trauma-informed training that our teachers go through the Department of Public Instruction. That will continue, as well as some additional pieces just to try to help staff recognize students who may be struggling in that area and provide some support. We also understand there's increased anxiety in our staff, and we're taking steps to reduce that anxiety through clear communication. We include staff feedback in our planning, and we try to communicate regularly so that as there are changes, we can try to let people know that as soon as possible. We know that what we say is the plan today might not be the plan 2 weeks from now, but the sooner we can let people know and what kind of supports are in place for that, I think then the better that people can adjust. We're kind of talking through plans and plan changes based on different scenarios that could happen throughout the year, just so that we'll be best prepared for the responses that we might have to make as we go. It's a little bit tricky to balance timely communication and accuracy, so when we communicate with our families, we always kind of say, as of this point, here's what we're doing, and here's what we anticipate for the future. The other piece I'll just mention, because there's been some in the media on substitute shortages, and I will say most districts have had some difficulty having enough substitutes even in prior years. We do anticipate many of us having some difficulty with that this year. Many of our substitutes are people who were retired teachers or were teachers and they're retired. So some of them, many of them have either someone in their family or someone they see regularly who might have some compromised health or might have some worries. So we're contacting our regular sub pool to find out who plans to come back, who plans to sub, and we're working on strategies on how to expand that pool and kind of promote that. Thank you.
Take any questions?
I know you said you didn't have a lot of data from the big testing last Monday, but looking back at it now, 9 days ago, overall, how did it go? And of course, do we hope we can get another one in another few weeks, couple months? Just your overall thoughts on how it went.
Great. So the question is, how did the testing site location go? And that was on the last Monday, July 20th. And I would say overall the testing event did go really well. We had 434 tests that were given. We were there from 11 to 7, and we had people starting to line up already at 8:30 in the morning. Early on in the testing site, we did expect that we would go through the 400 tests that we requested, and so we did request an additional 150 tests. We wanted to ensure that everybody who wanted to get tested could get tested at the location that day, and thankfully we were able to meet that, that everybody that did show by 7 was able to get tested.
And what you were saying earlier, we don't know, we can't say out of those 434, we had 5 or 10. We don't know how many from just that group.
Correct. We don't have the final data yet. What we are looking at in relationship to the data is how many people or percentage of people were symptomatic versus asymptomatic. What was their county of residence? You know, how many Chippewa County residents showed, and how many residents from other counties. You know, each county that the person resides in that gets tested is alerted of that test result. And so we would like to see our overall positives from that event as well. And some of our positives could be from other counties.
And did we have hopes of having another one of those again soon?
Oh, excellent. Thank you. Sorry, I forgot that part of the question. Hopes of having another testing event like that soon, yes. Throughout the state, local health departments are working with the State Department of Health Services and National Guard. We don't have something on the docket right now for a date or location, but as we organize with the state on that, we will definitely let people know about community testing locations.
Going back to the prison, did you say all 1,800? So essentially every inmate plus all the guards? Okay,
Yep, so
the entire...
yeah, the question kind of pertains to Stanley Correctional Facility, and that every resident and staff person were tested, and thankfully they all came back negative, because having an outbreak in a correctional facility is not ideal for anybody. It's disease can spread really fast in an environment like that.
Is the correctional treatment facility going to be done soon then as well?
They actually were recently done, and I haven't seen the total data from that, but the Chippewa Valley Correctional Facility was also tested recently.
Okay.
If there were any positives from the testing at the fairgrounds, will those already be counted towards the state county total, or do you guys have to wait till you get the full results back before those will be counted towards the county totals?
Great question. So the question is, are the people that tested positive from the testing event already counted in county and state data, or are they not? And the answer is they are already counted in state data, because the county where they were tested already has their results and has reached out to the individuals that tested positive. We simply are waiting for that final comprehensive report from the National Guard so that we can really break that data down. And we do want to make sure that we're giving accurate data, so we need to wait until we have that final report.
I know this is partly a question for Jenny as well, but if we're still saying limit to 15 people inside, we know, including staff, there's 1,500 at the high school. How concerned are you right now? Obviously, we still have a month to go, but how concerned are you right now with going forward?
Great question. So right now our indoor recommendations are 15 while using physical distancing. School districts obviously have more than 15 people with students and staff that will be coming into the building. And how concerned am I? I am concerned for schools and for safety. I do think the schools have done the best job they can possibly do in preparing, and some things that they're putting in place are techniques like keeping kids in cohorts or small groups so that they're not interacting. Say you have a class of 20 kids, you don't have close contact with 19 other kids, you have close contact with a group of 3 other kids, which will help mitigate the risk of spread of the virus if a child were positive or a classroom teacher, using physical distancing as much as possible. And the other thing that I do think is really important is for kids that can wear a mask to wear a mask, and for staff to wear masks. Now, there are some recommendations by CDC on who should not wear a mask, and there are some people who should not wear masks. There are some chronic health conditions, some mental health conditions, and also anyone under age 2 should not wear a mask. So we definitely go over that guidance with the school districts and talk about who should and who should not wear a mask. But anyone who the CDC recommends should wear a mask, it would be extremely helpful to have staff and students making sure they are wearing masks when the doors reopen.
I warned you I was going to bring this up. In about 10 days, there's slated to be a big foot race here in town. Obviously, we've had no mass gatherings, races in the Chippewa Valley, anywhere all summer. Have you reviewed their plan? Do you have any concerns? They're talking about a staggered start time and asking people to wear masks at the start of the race, but have you talked with anyone from the Y, or do you have concerns about that?
So, and thankfully in our health department, we have a nice structure of different people. And so Jim Kaler, who's our safety officer, has worked with Pure Water Days and the YMCA to try to provide safety recommendations for the start of that race. Again, we are recommending 15 in indoor spaces and 50 in outdoor spaces while physical distancing. Their plan does include staggered start and trying to spread people out, so that is a good thing. But obviously, they are going to have more people than the 50 in outdoor spaces.
Going back to the schools a little bit, in regards to transportation, how is it that they're going to handle some of the busing? I know she was mentioning the staggered drop-offs and stuff, but sometimes kids are on the bus for an hour, and are they going to limit the number of kids on the buses, or I guess how is that going to be handled?
It's a great question, and it does look a little different district to district in the protocols that people are putting into place. And as Jenny mentioned, all of the schools do have a plan put in place, and most of them have sent that out to parents or have it posted on their website. So I would encourage everyone to look at their local district for information on that. I can just tell you a few things that I know, and then Jenny's always welcome to come back up and talk about that too. I do know that some school districts are asking parents that can drop off and pick up to please drop off and pick up, to limit the number of people that are on the bus, and to space them out every other seat on the bus when possible. So those are the two that I'm really aware of, but Jenny can share more.
I can just speak a little bit quickly to some of the work that we're doing. So we're adding probably 2 to 3 bus routes likely, just to have less kids. It still isn't going to be enough that everyone can have the physical distance that they should have, but to be able to do some of that, for our buses, and I know for many districts, there'll be assigned seats, so students will fill the bus from the back to the front. And we're going to ask them to sit in family groups, which not everyone will appreciate, but just for that bus ride to try to, again, minimize risk and maximize the safety of everyone. So those are some of the pieces that we've been doing that I know other districts are doing in a similar way. And we were surprised when we surveyed our families. One of the questions we asked was if they plan to utilize the bus transportation or take their own children. We thought maybe there would be a big difference this year due to COVID, and for our community there was not. Most of the students who have ridden the bus in the past said they plan to ride the bus. So that's why we looked at adding some routes to try to have reduced numbers and then having just some protocol with them. The other piece that we're still discussing that Angie mentioned is masks. When are masks going to be required for students that are able to wear them? And so those are pieces that we're still talking about as well.
Any other questions this morning? All right. I just want to thank everyone for joining today and caring about public health. Remember to wash your hands and your mask. Keep physical distancing for those outside of your household, and wear a cloth face covering. Thank you and have a great day.